Good evening, everybody. Thank you so much for joining me tonight on YouTube Live. I'm Dr. Howard Elkin, the medical advocate, and tonight we're going to focus on bodybuilding. That's right, bodybuilding, also known as resistance training, weight training, or more commonly strength training, is vitally important to your exercise program. Now, in functional medicine, we focus on finding the cause of problems, but we also really focus on lifestyle. And lifestyle includes nutrition, exercise, supplementation, stress management, sleep, and anti aging. So that's where exercise comes in. Now, as medical advocates, you all know the importance of exercise. It should be a critical part of your everyday activities. And in fact, the chapter of my book that's coming out in the next year is entitled "You Gotta Move," and you really do have to move. So, exercise in general has a few very important properties. First of all, it helps to stave off disease. We're talking heart disease, cancer, diabetes, and osteoporosis. So, if you want to minimize the ill effects of those diseases, you really do have to exercise. Also, it's important to for memory. Now, I always tell people that, like, I'm a cardiologist and I want a good heart, but I don't want a good heart if I have a bad brain. And that's where exercise comes in. It increases the blood flow to the brain. So it's vitally important. And also, chronic disease, and even if you have a chronic disease, heart disease or cancer or whatnot, you can lower your chance of dying by 50% with regular exercise. So the role is definitely there. Now, what is the reality? The reality is that only 20% of the adult American population exercises on a regular basis. And that's pretty sad, right? Especially with all the knowledge that we have about exercise. So let's look at what are the guidelines? So the U.S. government guidelines says that we should be exercising about 2.5 hours a week. 2.5 hours a week. And that should be moderate to intense aerobic exercise and about 2 sessions a week on weight training or strength training. Now, those are the guidelines, and also if you look up the College of the American Academy of Sports Medicine, and also American Heart Association, those are pretty much the same. 30 minutes, 5 times a week of aerobic activity and a little strength training. And so, I mean, 24 hours. There are 24 hours in a day, right? Which makes it 168 hours in a week. Now, out of 168 hours, don't tell me you can't find 2.5 hours to devote to aerobic activity and, let's say, 2 30-minute sessions for strength training. You just have to do it. That's all there is to it. And as a medical advocate, we make that effort. It's that important to our well-being. So let's jump over to resistance training or weight training, which is really the focus of tonight's presentation. And so I want you to know that resistance training has been studied extensively in those over the age of 65, and the benefits are huge. First of all, it increases muscle strength and muscle endurance. You can do more when you weight train, and you, of course, have greater muscle, and muscle mass is very important because it improves a lot of things that happen when you age. You develop this thing called sarcopenia, which you actually lose muscle or muscle wasting. We see that with a lot of patients that have chronic diseases. You can help prevent that with regular weight training, and also improves your strength, and we'll talk about that in a couple of minutes. It improves bone density, which is really important. We all know the effects of osteoporosis. It also helps us with coordination and balance so that we are less likely to fall and fracture a back or a hip. It improves sleep, and it helps to decrease or minimize the effect of depression. So it's beta endorphins, and which are these peptides that are secreted by pituitary gland in the brain. So the effects of strength training are huge. And I think the most important thing is the ability to be able to live independently. And because let's face it, if you can't open a jar or shut a window or hang a picture frame or walk down a flight of stairs, that's a problem. It's hard, and that's why so many people end up in nursing homes today. It's because they've lost that ability to be independent, and that's because they haven't really used their muscles. The old adage, use it or lose it, it can't be more true. And so I always say muscle is your greatest ally. I don't care what your age is. I don't care what your gender is. I have women that say, I don't want to get big. I don't want to get bulky. Believe me, you're not going to develop muscles like this by just doing some weight training. And it's really important to keep that in mind. And some people say, I just want to get toned. Well, if you look up the word tone in the dictionary, there's no real definition. There is no real definition other than the fact that it was related to improving your strength, okay, which is really what weight training is all about. Now, what about resistance training in the heart? And I'm really happy to hear, to tell you that there's been more and more studies in the last, let's say, 6 years on resistance training in general and the effects on the heart. For years, this aspect of exercise has been ignored in favor of aerobic exercise, which is still very important, but we didn't know any of it. It's kind of like the resistance training or weight training has been kind of relegated to a back seat. But now we know that that lifting weights can reduce your chance of a heart attack and a stroke. In fact, in the one journal that I like, it's called Medicine, Science, in Sports and Exercise, did a study in 2017 of 35,000 women, and women who performed any resistance exercise whatsoever decreased their chance of a heart attack or stroke by 17%, which is not insignificant. That's pretty significant. There's another article in the same journal in 2019 that studied 13,000 patients, and that was both men and women. And resistance training, using resistance training less than an hour a week, let's say 2 3-minute sessions, can decrease your chance of cardiovascular disease and all-cause mortality, independent of any aerobic activity. So there's no question we now have the evidence that states that strength and weightlifting, bodybuilding, whatever you want to call it, is really beneficial to our health. And as medical advocates, what my point to you is that I want you to remember one thing: muscle is your greatest ally. Okay, regardless of your gender, regardless of your age. So that's what I'm going to leave you with. And now we have time for questions and answers. So please give me your questions. Am I on? Okay. I am live, but I don't see anybody in my chat box. So I'm just going to go on. These are a few questions that I had lined up. These are a few questions that people ask me all the time. So I'm going to answer them for you. Does it matter when you train? Actually, it doesn't matter when you train in most cases. The important thing is just to find the time that works for you. Some people are morning persons, some people are evening people. I'm kind of a morning person. Now, if you have difficulty sleeping at night, and that's truly a problem, you might want to not work out at night because that can affect your overall ability to sleep. So that's important. So what else? What is a strength training session like? Okay, well, it really depends on how you want to do it and with whom you're working. First of all, it could be with weights, it could be with bands, it could be with machines. There's so many different ways of doing strength training today. And if you're a novice, I really recommend that you start off with a trainer. And actually, I would find a trainer that can deal with special populations like older folks, supposed to be working with 20-year-olds, and also people that have had orthopedic injuries. It's really important to find a trainer, at least to get the basics down or to work with someone who really knows it. The worst thing that can happen is that you end up working with weights and you get injured and then you just quit, which we don't want. So we want you to be persistent in the activity. Okay. Let's see. So how to get started. I think I kind of alluded to that. Find a trainer or train with someone that knows what they're doing. There's plenty of things online with YouTube that can give you some hints. I like people to do a total body workout, which includes upper body and lower body. And what you might not realize is that 60% of your muscle mass is below the belt. So it's really important. Everything starts from the legs up. Every sport, bodybuilding, dance, martial arts. So we have to be grounded. And we need a good core strength, but we also really need very important leg strength. So you want both upper and lower body. As far as how to do it, I would say starting off with total body workouts is a good way to do it. Then you can do what we do as we get more advanced, and that's doing a split. Like I may do chest and biceps one day, I may do back and triceps another. It doesn't matter. The important thing is to just do it and incorporate into your activity. And so, how much? What is if strength training isn't your thing, and it may not be for everybody? Try to spend twice a week, 30-minute sessions at the most. That's an hour a week, and you will get significant benefits. It's been proven. The data is here now. We now have the data. You don't have to be a bodybuilder to achieve the benefits of weight training. So please remember that. Um, let's see. Equipment, again, you can do things like bands at home. Resistance bands are very good. I like bands because you get a contraction, and you also feel the resistance uh, as um, finish the movement. And people also ask me, how does actually weight training help with bone strength? Because every time you walk or every time you pound or contract a weight, okay, whatever you're doing, you have a tendon pulling on the muscle is pulling on the tendon pulls on the bone, and bone is living tissue. It's not just a matrix of calcium, it's living tissue. And to keep on building and to keep on laying down calcium, we have to have active tissue. So the way to build bone is to weight bear and to do resistance training. So again, the muscle contracting will pull on the tendon, which will pull on the bone. So they work synergistically, and the end result is bone growth. And that's a way to stave bone loss, which happens as we get older. Um, does muscle burn fat? Yeah. Now it burns fat indirectly. And it's important because aerobic activity will definitely burn calories. There's no question about it. If you're on the treadmill for 30, 40 minutes, 45 minutes, or the elliptical, whatever you like to do, you will be burning calories. But that calorie burn will end shortly after you finish the activity. It doesn't last but so long. And that's the difference, because with weight training, you indirectly build muscle, which is really important. So you build muscle you're directly building muscle, but indirectly burning fat. And this is how it works. So if you look at a pound of fat versus a pound of muscle, there's a difference of like 33 calories, something like that. It's quite a difference between a pound of fat. You can be almost dead. And the blood flow is so low. The blood flow to muscle is extremely high, like 35 grams, calories per gram. So anyway, the important thing here is that as you develop muscle, which is what weight training does, you will be burning fat because it increases your aerobic it increases um your mathematics, your caloric burning. Sorry. So if you want to burn fat, you build muscle, because that increases your metabolic rate. That's what I meant to say. So muscle will increase your metabolic rate, which indirectly will cause fat burn. So let's say I'm watching TV with someone who's my age, my size, my gender, but I have muscle and that person doesn't. He doesn't have muscle. I'm going to be burning fat sitting down watching TV versus than the other person, because I have more muscle. So more muscle you have, the more fat you're going to burn. That's why bodybuilders tend to be pretty lean. And we also have very good insulin resistance, which is important. We've talked about that a lot in my YouTube videos. So insulin resistance is kind of like what happens to us as we get older. We become less active, we gain weight, we continue eating carbs and excess calories. And so our body doesn't really know how to deal with our insulin, or doesn't recognize it. So what happens, we get fat. And we become a metabolic wreck. We develop things like fatty liver, high triglycerides, and also not good for the brain. So it also decreases our brain power. So exercise in general is great, and bodybuilding is great. And let's see, do I have any questions here? My glasses on. Thank you for the compliments. Now, anybody have questions? Because I think I've answered all the questions that I put together. We talked about burning fat. We talked about osteoporosis. We talked about endorphins, these peptides that are really released whenever we do exercise. And I think we pretty much did it. So this is really an early night. So I'm just going to leave you with one thing, and that is don't neglect resistance training as part of your exercise regimen because it's the biggest bang for the buck. Yes, you need aerobic activity, but if I only had a half hour to spend, I would spend time doing strength training if you want to improve your strength and improve your muscle and to be able to live independently. So that does it all. And now we have evidence that it also helps the heart, which is very important. So, anyway, I don't see any questions. So, build your muscle, stay healthy, and Merry Christmas to you all. Thank you. Okay. Oh, sorry. How many hours a week? I got a question here. Good. How many hours a week on resistance training? Well, it depends on the individual. I would say a minimum should be like 30 minutes twice a week. You'll get good benefits from that. I do usually 4 hours a week. I do four 1 hour sessions. But that's because it's a favorite sport of mine and I do it regularly. But I've kind of taken it to a whole different level, and it's not necessary. You don't have to do what I do. I just want you to do it. I want you to just to move and develop strength, and of course, muscle will come with that. Good question. So it's not as much as you think. You can really get the benefits by just being habitual about it. It should be like a regular activity. Schedule it. That's how I tell people they have to schedule the activity. You have to schedule it. Uh, well, I guess there's an alert going on. It's not mine. Anyway, I think that's about it. Let me see. If there's no more questions, I guess we'll just have to sign off today. So listen, guys, have a happy holiday, and we'll see you in a couple weeks. Thanks.